Good morning everyone. I am Dr. Anand, Pediatric Orthopedic Consultant at Ankura Hospital for Women and Children. The flexible flatfoot, which is the more common variety, more than 80 to 90% of the cases will always, most of the times, be flexible flatfoot. In a flexible flatfoot, what happens is the arch completely collapses and also there is hyperflexibility of the ankle and foot joints. And also what we need to understand about flat feet and the anatomy of the foot is that our human foot is like a tripod. So there will be a medial longitudinal arch, a lateral longitudinal arch and a transverse arch. The collapse of these arches is called as a flat foot. And another thing to understand is that these arches are maintained by the foot muscles, tendons and ankle muscles and tendons and also the bony architecture. The most important muscle is tibialis posterior and the plantar fascia that maintain the arch of the foot. So when all this one of these components is not working properly, the arch collapses and the baby walks with a complete flat feet. So in a flexible flat foot, the most important clinical examination is that dorsiflexion of the great toe leads to reappearance of the arch. And also when you ask the baby to stand on its toes, the arch reappears and the calcaneum, which is also lateralized, completely centralizes and is in unison with the foot. So if at all this clinical test is positive with the baby, it is definitely a flexible flat foot and doesn't require any other investigations, and treatment protocol for this is also very mild and the baby will live a normal healthy life for the rest of its life without any complications. In a flexible flat foot, what we also need to remember is that the baby has hypermobility of the joints. That means there is something called as a Beaton score. In that what we do is the thumb is able to touch the forearm and also the four fingers can go into a parallel phase with the forearm, and also there will be hyperextensibility at the elbow and the knees, and also the baby will be able to completely place its palms on the floor without bending its knee and bending only its back. With the Beaton score of more than 6, it means that the baby has hypermobility, and because of that issue only, the tibialis posterior being a little weaker, the feet go into complete collapse and into valgus. This actually doesn't require any treatment or any surgical procedures or any footwear modifications to make sure the baby walks normally. The baby's performance only reduces with footwear insets or footwear modifications. So the baby will be treated with very simple physiotherapy. That is, first thing, walking on toes. Second thing, walking barefooted, and walking barefooted on hilly surfaces or pebble paths, and also strengthening of the tibialis posterior muscle. So if at all the baby follows this kind of physiotherapy over a long period of time, it will live a normal healthy life without any complications.